Hello and good morning, everyone. My name is HCD, and together my team and I have created a health communication campaign about alcohol abuse in college students. But before we get started, just a little trigger warning. This presentation does have some sensitive topics related to sexual assault and rape. So just a little trigger warning. But okay, without further ado, let's get started. We're going to start off with some facts and figures. So about 80% of college students drink alcohol to some degree, which means that they drink a certain number of drinks periodically, whether it be a couple drinks a day, a week, or a month. It doesn't really matter. 20% of college students meet the criteria for alcohol abuse disorder. This can be classified as the inability to control drinking due to both a physical and emotional dependence on alcohol. Next, we have some facts straight from the ASU Health website. So about 47.2% of ASU students do not drink alcohol, or they recorded not drinking alcohol in the past 30 days. About 80% of ASU students either did not drink alcohol or consumed just a couple drinks the last time that they partied. And as you can see from the numbers here, above 50% of all ASU students drank responsibly, which means that they used a designated driver, they stayed with the same group of friends, they ate before and or while drinking, maybe even after, and they kept track of the number of drinks they were having. These are all really important when you're drinking responsibly. Let's move on to college alcohol abuse. So we all know that drinking in college is nothing new. Students come to college expecting to engage in drinking behavior, and many of them have already been drinking throughout high school. A big factor that can play into why college students drink can be related to stress. With many new freshmen coming to live on campus, they may find themselves stressed out and overwhelmed when they're trying to now juggle their new responsibilities, such as wanting to fit in, wanting to get the full college experience, pressure to do well, experiencing living away from home for the first time, and dealing with anxiety and depression. They turn to substances such as alcohol that can be seen as quick, temporary solutions that can deal with the problem in the moment. But the thing that they fail to realize is that when they continue to use alcohol as a coping mechanism, it can really easily lead to dependency on alcohol just to continue functioning in the future. And this relates to binge drinking. So according to the National Institute of Alcohol Abuse and Alcoholism, binge drinking is when the alcohol concentration in your blood reaches 0.08 grams per deciliter. And this usually happens when you drink about 4 to 5 drinks in less than 2 hours. The people that are most prone to binge drinking are those under 21 years of age, which is our target audience for this campaign, which are obviously freshmen and younger students. Now we come to the dangers of alcohol abuse. So we have first-hand and second-hand consequences of binge drinking, and we'll go through some examples of each. So for the first-hand consequences, there is death, assault, risky behavior, sexual assault, and unsafe sex practices, and some academic problems. We found that students participating in binge drinking are 6 times more likely to perform poorly in class and 5 times more likely to skip class altogether. Some secondhand consequences of binge drinking, which secondhand consequences mean that the effects that you have when you binge drink on the people around you. So these include interrupted study or sleep, need to care for a drunken student, unwanted sexual advances, sexual assault or date rape, and personal physical attacks such as pushing, hitting, or assaulting, or just getting into fights pretty much. So this leads us to prevention strategies about alcohol abuse, and we came up with a couple different ones. So for the first one, we said that we wanted to promote healthy behaviors through several different methods, such as motivational interviews, having guest lecturers and doctors and health professionals talk about the negative effects of alcohol abuse and who really is susceptible to binge drinking. We wanted to increase screening and outreach, provide more resources about where you can get help, either for yourself or for someone you know that might be in danger of binge drinking. We wanted to train RAs, peers, and faculty to be inclusive of various student subpopulations, because there are some subpopulations that are more prone to binge drinking than other ones, such as students from low-income families or minorities. So for the second one, we wanted to pay attention to environmental factors on campus and in the community. And we discussed this earlier, where we talked about how freshmen get really stressed out when they first move into campus, because they have all these additional new responsibilities that they haven't ever had to face. So that it can get really overwhelming. And then the last and third one was just communicating the institutions, the communities, and also Arizona's alcohol policies to students, as well as parents, before and after they arrive on campus, so especially during student orientations. Our target audience was college students, but more specifically freshman students and younger students, and especially those living on campus. We made sure not to discriminate between students of all genders, sexes, races, religions, ethnicities, and sexual orientations. For the goals of our campaign, we followed the SMART objective. So for the specific section of the SMART objective, we wanted to have college freshmen reduce their alcohol consumption. For the measurable aspect of the SMART objective, we were going to measure how successful our campaign was by surveying freshmen after their first semester, and then seeing how many students actually drank alcohol during their first semester. For the attainable part of the SMART objective, we would want to use flyers, posters, emails, spread them all around campus to spread information, provide resources, prevention strategies, stuff like that. For the relevant part of the SMART objective, we aimed at improving grades of college students, reducing negative health effects, making sure that they are able to develop better relationships with their peers, and also help with any legal trouble that they might get into. And for the time-based portion of the SMART objective, we were looking at a 6-month campaign where we would evaluate the college students, ask them questions, assess how much they were drinking, and obviously target freshmen. So the health theory that comes into play here is the health belief model. Basically, what the health belief model states is that people that know and believe that they are susceptible to negative health effects or at a certain health risk will be more likely to engage in preventative behavior. So they will be more likely to practice behaviors that will allow them to decrease their negative health effects or just put them out of risk entirely. And it focuses on the power of self-efficacy through perceived belief. There are some various parts to this model, such as perceived susceptibility, severity, health motivation, perceived benefits, and barriers, which we're going to explain in this section here. So for perceived susceptibility, we wanted to make sure that all college students know that none of them are immune to the negative effects of alcohol, because even if they think that drinking a couple drinks a week isn't going to do anything, it has a very real chance of turning into something more serious, such as binge drinking. And as we all know, college campuses are a really high-risk environment for binge drinking. For perceived benefits, we wanted to make sure that students knew that what reducing alcohol consumption could do for themselves, such as they could improve their grades, improve their mental and physical health, reduce the likelihood of accidents, and also improve the relationship with people all around them. For perceived severity, we wanted to make sure that people knew how severe binge drinking really was, because like I mentioned before, Even drinking a couple drinks a week can lead to dependence, which can also lead to more serious cases such as liver damage and also death. And as we mentioned before, it can lead to a lot of secondhand effects such as experiencing sexual assault and failing your classes or just getting in a bunch of legal trouble. For perceived barriers, we found that some barriers to spreading this kind of information and actually having it affect the students would be that students have this need to fit in and be like everyone around them so they can make friends, which is also that social peer pressure, which ultimately can lead to addiction if they don't stop it beforehand. Our cue to action was reducing promotion of alcohol in fraternities and sororities. We thought that we could do this by inviting doctors and health professionals to lecture them about the negative consequences of drinking. We thought that we could implement stricter repercussions for excessively drinking alcohol, maybe implement random breathalyzation. We could have some mandatory freshman courses talking about alcohol abuse, binge drinking, prevention strategies and resources, stuff like that. And finally, we thought that we could use flyers and posters with a free food incentive, which we'll get into later on. So our campaign message, we wanted to obviously inform the students of how bad these health effects can be if they keep binge drinking, and we wanted to display data and statistics in a really easy and accessible way, and obviously provide prevention strategies and resources that could help people identify if they're at risk and also get the help that they need. So we came up with the campaign message, Rethink Your Third Drink. We wanted to aim at reducing the number of drinks that college students have instead of completely stopping them from drinking, because we thought that that was a more realistic and achievable goal. For our communication channels, we came up with a couple different methods. So for the first one, posters, we wanted to create really aesthetically pleasing and informative posters that we would put up in the more populated areas on the campus, such as libraries, cafes, and study rooms. And through personal experience, we agreed that students don't like being bombarded with flyers on their way to class because we're already rushing to get to class, and then some person comes up to them and starts talking about stuff that they don't really care about at that point. So we thought that posters would be much more effective. The second method that we came up with was emails, since about 95% of undergraduate students own a laptop or a smartphone. So we thought that that was a good way to reach a majority of students. Another way that we came up with was to set up a booth. We would offer free food, stickers, stationery, and t-shirts with a short, catchy message related to alcohol abuse. And at the booth, we would offer flyers that students could pick up on their own if they were interested, which we thought was a better way of relaying and conveying the information. And lastly, we thought that we could create an Instagram account where we would post data, statistics, prevention strategies, resources about alcohol abuse, and at the booth we would offer free food or merchandise if they followed the Instagram account in front of us. Here are some examples of posters about alcohol abuse on college campuses. We thought that these were effective because they had statistics and data, they had attention-grabbing graphics, they had the negative effects of alcoholism, the characteristics of alcoholism so that students could read it and understand if they themselves were at risk or if someone that they knew were at risk. And then here are some other examples. We thought that this was also interesting because it doesn't have a lot of information, but it does use the peer pressure in a good way by making sure that students know that if they drink too much, then it's not going to be accepted by students around them, and it's going to have a negative effect on how they create relationships with their peers. For evaluation, we wanted to create a pre-test and post-test. We would do that 2 months before launching the campaign and 2 months after the campaign. We would ask questions that would talk about how much the students, how many drinks they had per week, how often they drank, and if their attitudes towards drinking had changed at all. And then we thought that we could compare test scores of self-reported drinkers and non-drinkers to see if there was any real difference, so that we could advocate for reducing alcohol consumption. And that's about it. Here are our references. And yeah, thank you so much.